Hello, namaste. Welcome to our channel Becoming Conscious Being. It is a platform for your mental health and well-being. And in today's podcast video, we are going to talk about the mental health of mothers during pregnancy and even after that. In fact, also the news and experiences that they have before the pregnancy journey starts as well. And for that, I have today with us Dr. Paridhi Mehra. She's the founder of Happiness, and that's just what her platform is all about: maternal mental health and caring for mothers. So, welcome, Paridhi. I would want you to introduce yourself and the organization.
Thank you, Purvi. Thank you for inviting me to your platform. Hi, everyone. I am Dr. Paridhi Mehra. I am the founder of Happiness and a toddler mother. Happiness is an emotional and mental well-being platform for new and expecting parents. We are working in the field of perinatal mental health, trying to support the mothers, the families who need support during their parenthood journey.
Mhm. So, just for the context of our audience as well, from my understanding, you can definitely add on to it more, Paridhi. Um, Perinatal health is basically where we're discussing about all that one goes through during the pregnancy and after that, which would also include postnatal, which would be the period after childbirth that the mother needs to kind of recover and restore her health and well-being. In most places, they usually focus on their physical recovery, uh, where it pertains to that. But in this recovery, it also ensures that the mother feels more like herself. Her emotional and her, psychological well-being is also to a lot of extent taken care of and restored globally and in India, right? Whereas while the prevalence is say around 30%, 31% as per the recent research, right? Regarding where it's not just affecting their physiological health, but it does affect pregnancy and childbirth, does affect new parents with their psychological well-being, emotional well-being, even social well-being as well. And there's so little services and even talks around mental health around them, well-being, right? Maternal mental health is in general is so less talked about. There's so less services that we have around in this field. Just curious to understand, how did you start working in maternal mental health? How did my happiness come to form for you?
So happiness was born out of personal struggles with postpartum
Mm.
depression. Around 2 years back, I became a mother, and I experienced postpartum depression myself. Um, it was a tough time. I think one of the toughest things that I faced during my life, and that's when I started Happiness to support the other moms and to provide them the support that I did not receive during my time.
Yeah, I mean, and I really applaud you for that, and I'm so grateful that you, among others, are bringing up, these services for mothers, because that's an experience that a lot of mothers go through, as to what you experienced in your journey as well. Where I see that in my practice, in my, women around me also, where they've had similar experiences that, there's a lot of talks, a lot of services that cater to their physiological concerns, whatever they're having, right? But no one to really listen or really adhere to what they're going through mentally, socially, for themselves. So, I mean, it's great that it's come up. And like you said, it's not even talked about by professionals a lot, by
Yeah.
say gynecologists or other doctors that you see. So oftentimes they don't even know that okay, there's something called perinatal mental health that's there for me, or postpartum blues is something that many mothers go through, and it's not a singled out experience then for them. So definitely that's something. How
Absolutely.
has your so what was your pregnancy journey for yourself?
Yeah. So pregnancy for me, it, physically, it was a great pregnancy. I did not
Hmm.
even have, those initial months of nausea, etc.
Hmm.
Physically, it
Oh.
was, I know. So physically, it was great. But right from the time I conceived, I started getting very anxious and very stressed about,
Hmm.
little things, be it
Mhm.
the health of my baby, or how will
Hmm.
my relationship change, or even body image issues. And I
Yeah.
did not have any such issues before I conceived. But at
Hmm.
that time, trying to understand why is it happening, is it to do something with pregnancy or the hormonal changes was tough, because I went through all the antenatal checkups. Everything suggested that everything is great, the child is doing good, the baby
Yeah.
is doing good. But even after that, there was not one check where there was mental health screening which was done, which is
Yeah.
a common practice, I think, in Western countries. But for some reason in India, it's not very common
Hmm.
for women to go through mental health screening, either during
Hmm.
pregnancy or even after childbirth.
Yeah.
So for me, yeah, like I said, pregnancy was great physically, but mentally, I could see that there were some changes which started happening right from the time I conceived.
Definitely. And I think the lack of screening is also to do a lot with how everybody expects it to be the most happy journey for you. And, so sometimes bringing that up, there's a lot of denial of that, a lot of ignorance towards that. And, regarding addressing that, okay, mothers must be going through so much stress and anxiety, right?
Yeah,
Yeah, and I mean, I do resonate with all that you said. Something I've seen around as well, that the stress and anxiety of, because each step is looked into so much and everybody has so many information to give, so
yes.
many lookouts, right? That look out for this, be prepared for this. It can bring up a lot of anxiety, I mean, understandably so about, and also just with the changes in your way that your body is functioning can be so it can take a lot of time for the women to adjust to, like for
Yeah.
example, not being able to see below your belly, can feel the way you are familiar looking at yourself, all of that. Definitely. I mean, I can only imagine the stress that would come because it, like, like you said, the stress anxiety is also to do a lot with shifting in your roles so much
Yeah.
as a woman.
Be honest, since there is no education given
Hmm.
on that subject of mental health per se,
Hmm.
that is where it becomes even more, difficult. The women goes through the anxiety,
Hmm.
is feeling extremely anxious or stressed, but she doesn't understand why it's happening. It's not
Yeah.
normal to be anxious during pregnancy. Yes, little bit of anxiety about, will my baby be okay? Will everything be okay? Will I be able to manage?
Hmm.
All that is okay. But being extremely anxious about
Hmm.
everything around you is not.
Hmm.
And if
Hmm.
something of that sort is happening, definitely the expecting mother and the expecting parent should reach out for support.
Definitely. And in your experience informing happiness, what are some of these screenings or these certain lookouts that you would suggest mothers or families also to be mindful of?
Yeah. So with happiness, we have two kinds of programs that we work on.
Hmm.
Or let me put it this way first before explaining what we do with happiness. Now, the prevalence of postpartum depression is really high in India. It's around
Yes.
22%, which is
Yes.
around roughly 1 in 5 mother
Hmm.
going to go through postpartum depression. Whereas postpartum blues is extremely common. Around 80% of females will
Yeah.
go through it. Uh, Now, research has established that this is something which can be easily prevented
Hmm.
through psychoeducation, through expectation setting,
Hmm.
through regular screenings. So
Yes.
that's what we are trying to do with happiness. We have two kinds of programs. We have a preventive program for expecting couples, and we have a curative program, corrective
Hmm.
program for people who've already delivered and are going through postpartum depression.
Yeah.
So where the prevention is concerned, the question that you asked me, how can someone prevent, or what are the things to look out for? Um, Prevention, number one, what we do is we do regular mental health screening for the expecting mother. In case there's anything off, so there are standard scores. which we take. So in case we feel that there's anything off, then we psycho counsel her, try to understand, what's the reason of stress, what's the reason
Yeah.
for anxiety, and if that can be corrected. Because many a
Hmm.
times there can be an actual factor which is causing the stress. At other times, maybe it is stemming out of, the emotional
Hmm.
changes, the physical changes, etc. So we try and work with the couple
Yeah.
to make sure that the severity doesn't increase, or we can relieve the anxiety, because anxiety and stress during pregnancy has a detrimental factor on the developing fetus as well, the baby as well.
Definitely.
So that continues even after postpartum. Uh,
Hmm.
we psychoeducate the parents. We tell them that, look out for signs. For instance, if the mother, even after a few days of delivery, she's crying, a lot, she's feeling very low, she has extreme fatigue even after getting
Hmm.
enough amount of sleep. She's not able to attach or bond with the child very easily. She's very
Hmm.
frustrated. Um, these simple symptoms that the partner can look out for. So we educate both partners that if something of this sort happens beyond a few weeks, which is called as the postpartum blue, which is normal and self-limiting, then
Yeah.
they should reach out to us for help. Program as far as the corrective is concerned. So any parent who comes to us with symptoms of postpartum depression or anxiety, we have a team of psychiatrists, we have counselors, we have lactation consultants on board. So we try and create a program for them, and help them recover in their journey.
Definitely. I mean, I think that's a great system that you have going in your practice as well. And like you said, right, just the part of psychoeducating the couple and the parents during this phase, just hearing them out, and a lot of time to let them know, okay, what they're going through is something very natural, something also transitional in the phase. I feel puts a lot of their concerns at rest also for them, because
Yeah.
the stress anxiety that often builds up for them is because at this point everything comes to feel as a label. Like if I'm feeling this way, then am I a good mother? Would I be a good parent? And once they're educated, once they know that okay, this is something I will feel for some time, or okay, there's a term for that. This happens. And
Yes.
really help them also then look out for ways of how I want to cope with it,
Hmm.
ways of how I want to be prepared for that. And a lot of times when these screenings happen, I think this is also a way to open the communication between the couple as well. A lot
Yeah.
of times. So, what has your experience been?
Therapist available who I could have spoken to. The thing is that today mothers are reaching psychiatrists and therapists at a very, very late stage.
Hmm.
Um, by the time the mother reaches the psychiatrist, it has mostly transformed into from postpartum depression to postpartum psychosis. So
Hmm.
mostly women are reaching out for professional support at a very late stage where their
Yeah.
condition has already progressed from postpartum depression to postpartum psychosis.
Hmm.
And a lot has already been put on stake. So,
Hmm.
their child, their relationship, the entire family is now disturbed because the mother is in such a helpless state that she
Yeah.
has to be, separated from the child, or
Hmm.
something needs to be done. So, with the reason why we are focusing on prevention, and the reason and our focus with at Happiness is not just to provide psychiatrist support and to
Hmm.
provide psychotherapist support, because that is already there, but it is to provide support at a very, very initial stage.
Hmm.
That's why, uh, prevention is the key. So to start right from the time of pregnancy, because when you know that the prevalence is so high, why do you have to wait till the time the women actually
Yeah.
starts developing symptoms? So that's why um, prevention. And then even during the early phases, be it postpartum blues, just by, a lot of
Hmm.
women come to us in the first few weeks itself, and they may not need multiple sessions of uh,
Hmm.
therapy, or they may not need a psychiatrist to tell them this, but just speaking to a peer, understanding that okay, what I'm going through, like you said, has a name, and
Hmm.
it should subside within a few weeks. Or
Hmm.
this education that if this doesn't subside within 2 to 3 weeks, then I should definitely reach out for help.
Hmm.
That in itself is very useful, right? And then
Yeah.
even if it is postpartum depression, knowing that there is a term, there's a diagnosis for
Hmm.
what I'm going through, and it is not just because I'm a bad mother. Many people, like in
Hmm.
my own case, when I was
Yeah.
going through it, I constantly felt that, maybe I am not a good enough mother. Maybe I was not ready for this.
Hmm.
Uh, there were
Yeah.
moments, very dark moments, where I felt very isolated, very alone, just struggling with my own.
Yeah.
So
Yeah.
many mothers come to us in that particular state, and just by the virtue of understanding that there's a term for it,
Hmm.
and this is happening because of certain factors, and it is common, and then there are
Yeah.
other mothers out there who are experiencing this, that in itself is provides relief to a lot of
Hmm.
mothers. And of course, if the symptoms are severe, we refer them to professionals, but most mothers feel at least relief to some extent, just by knowing that they
Hmm.
are not alone, and then they have support, and then they have someone who can talk to.
Definitely. And two things come up to me when I hear you. One is definitely the sense of empowerment and safe space that they can feel regarding, okay, I can reach out for support. There are resources for me to access at this point, right? The fact that, okay, what I'm facing is something that I can easily recover from as well. So that empowerment also to share that experience, to be able to voice it out, is definitely, I think, a huge aspect of the prevention as well, where we have that enough safe space, open communication with them. And second, like you brought it up, I would want you to elaborate a little on what is postpartum psychosis and how to go about that.
Okay. So when we talk about perinatal mental health disorders, it's a bouquet of terms.
Hmm.
Um, so perinatal means anything to do with pregnancy and childbirth. So
Hmm.
perinatal includes both uh, issues during pregnancy and then issues postpartum, that is after
Hmm.
childbirth. So there's a term called as perinatal anxiety, meaning or anxiety during the pregnancy period.
Hmm.
Then there is a term called as postpartum blues, which is a
Hmm.
much common condition. Around 80% of the females will
Hmm.
have this.
Hmm.
But this is a self-limiting condition which should resolve within the first 2 weeks or maximum 3 weeks after
Hmm.
childbirth. Then the next stage is postpartum depression, which is
Hmm.
again 1 in 5. Again, the prevalence is very high, around 25%. So that's the next stage. And then there is postpartum psychosis, which is a very severe form, which
Yeah.
probably needs some sort of intervention, some sort of medication, where the symptoms have become so serious that either the mother, uh, uh, you know, has suicidal intentions.
Hmm.
The mother may also have, thoughts about harming the child. So
Hmm.
that is called as postpartum psychosis.
Hmm. Definitely, and thank you for kind of sharing that with our audience today. I think that would help a lot of them understanding what it is and what all of this encompasses. I would also like to understand with you how important is the support from family and more importantly the partner at this point.
Yeah. Yeah. I think partners play the most important role in the entire
Mm,
journey. And when I say partners, let us not just, say that it is the mothers who will need the
mm,
father's support, but it could be the other
equally
way
needed.
also.
Yeah.
Because even fathers go through postpartum
Yeah.
depression, although the prevalence is lower as compared to mothers.
Mm,
But back to your question on, what is the role? So, partners play an extremely important role, because the person who's going through anxiety or depression or any form of, mental health issue may not be in a position to fully recognize that, okay, there's something off,
yeah.
right? So, for instance, during my time, while I was going through it, you know, it was all an internal process where I kept,
Hmm.
you know, ruminating is the word. So ruminating
Hmm.
with all the thoughts, the negative thoughts, and
Yeah.
I'm alone, thinking
Hmm.
about all the negative things. So during that phase, it is very difficult for the person who's actually suffering to figure out what's happening. And then
Hmm.
that's where the partner comes into picture, or the
Hmm. Hmm.
family, the one who's closest to the person who's suffering. So most often it is the husband or the partner who first finds out or who first recognizes that there's something
Hmm.
off. Either
Hmm.
the he or she can notice that the person is extremely frustrated, always angry, or always crying, or always disturbed,
Hmm.
or very tired. So all these things, if the partner notices that there are some issues happening, if the husband notices that the wife is
Hmm.
going through some of these issues, that is when he can reach out for help and first
Hmm.
talk to the wife and understand why is it happening,
Yeah.
what are the thoughts. So even that, what happens is, for the mother, it's not easy to share this with anyone, not even the
Yes,
husband,
exactly. Yeah.
because there's always this fear of judgment. uh,
Hmm.
that if I express this, like you said, for mothers, it is expected to be the happiest moment of their life, which it is undeniably, but with that happiness comes a lot of other uh,
Yeah.
things, right? The ups and downs of
Yeah.
being a mother. So it is for the partners who would first notice this, and then
Hmm.
they can definitely help in this process. Number one, talk to the mother, try and understand what she's
Hmm.
going through, if there's something that he can do. So share the
Hmm.
load with the mother, right?
Yeah.
um, because there's a lot that goes on there. You
Yes.
continuously have to feed the child, you have to take care of
Hmm.
the child gets up all through the night, every two
Yeah.
hours, so the sleep is disturbed. So, share the responsibility.
Yeah.
And then if you notice that these symptoms go on for a long period of time and they are worsening and not improving, that is when you should, try and take your partner, your wife, and seek professional help.
Hmm.
Because, right? Um, and then about the family. Now, what happens is, usually in Indian households, when the women delivers, there's usually someone who comes in,
Hmm.
whether it's the in-laws or the parents. Now, unfortunately, the previous generation, though they may have gone through this, they don't really understand or appreciate how much this can
Hmm.
affect, right? And it is
Hmm.
easy to forget your time when, it has been so many years. So that societal pressure also adds.
Hmm.
So for everybody around the family, it is very important to understand that, what are the things that the women may be going through, the mother may be going through, and be there for her. Try
Hmm.
and share the load. And if she wants to, talk, be there. Provide her the non-judgmental space at
Hmm.
home if it is possible. And that is the best coping mechanism possible.
Definitely. And just adding on to what you shared so beautifully is also the fact that, for the partners to just also support them in how to communicate their concern with each other also becomes a huge aspect because, like you said, right, while they notice the symptom and try to understand it from the partner, distressed partner, or taking them for any service, can sometimes feel a lot like, oh, I am being blamed or there's something wrong, right? So the just knowing about how I can empathetically talk to my partner, communicate. And one key aspect I have seen work a lot is when you acknowledge the distress also, along with wanting to know why it is there, but the fact that yes, it is there and it is difficult to go through that. Sometimes it just helps reduce the judgment and the distress so much because a lot of times what I've noticed a concern becomes that, oh, is this straining my relationship with my partner? Or am I being too much on my partner? Right?
Hmm.
Also, the fact that even with family, the fact that my role in the family, right? How that is shifting so much. The sense of agency and boundaries also around at that time to
Yeah.
sometimes feel like Will the family understand it? How are they going? How they respond to your boundary making when you're concerned? Sometimes plays a huge role, and at the same time becomes a huge support for the mother,
Yeah.
right? Because sometimes I've seen with mothers the fact that now that she's pregnant, a lot of people feel very comfortable to, uh, you know, touch their belly or come very close to them. It can sometimes feel too much for the mother, and the fact that so much of focus or control on their eating pattern can feel that the restrictiveness coming in instead of feeling that openness can also be a lot. So w- small things with mindfulness can become huge support for mothers in this time.
Yeah.
Yeah. Even the appreciation of them that hey, even if they're going through this, they're still able to bear with it. They're still able to go through all of that. Because while other people are mindful of the mood swings, it can be too much for the partner to even see or feel those mood swings, these
Yeah.
heightened emotions at times. And just empathy on, hey, I see that you're managing through this can be
Mm.
a huge support and uh, provide a lot of safety and comfort to both the couples in this stage.
Yeah. Mm.
Definitely. Mm. So, Paridhi, if you could also just elaborate a little on, the changes in the relationship that happen. How does that affect the mental health of the partners, the mental health of the mother in the even during in the postnatal stages? What impact does it have?
Yeah. So I think you've brought up a very important point. Um, Relationship changes. I think it's very important to understand that
Hmm.
when you transition from couplehood to being parents, things are going
Hmm.
to change.
Yeah.
You know, the intimacy levels change. The time that
Yeah.
you have for each other is going to change.
Yeah.
Um, you know, so usually what happens is couples, uh, when they get into this, they don't realize that uh,
Hmm.
there are things that are going to change. And when it actually changes, since they were not prepared for it, it actually affects their relationship, their mental
Yeah.
state, their emotional state. Um, and for both sides. I mean, like we said, intimacy changes can happen.
Hmm.
So, one of the partners may not be available. And in most
Hmm.
of the cases, it is usually the mother because she has
Hmm.
to breastfeed the baby. She is already so, consumed with childcare responsibilities that she has little energy left uh,
Hmm.
engage in anything else. Um, Even for the fathers, there's this thing called as fatherly feelings that start coming up right from the time of pregnancy. So again,
Hmm.
I've heard from many people that they may not feel the desire. There's a change
Hmm.
in the intimacy patterns even there, where because of fatherly feelings, they may
Hmm.
not really want to be very intimate with the mother.
Hmm.
That in turn may have an effect on each other. Then
Hmm.
when the child actually comes in, uh, both the parents, if they're sharing the responsibility, most of the time goes into that. So again, the way the couple could spend time before the child, that is no more there.
Hmm.
And that takes a lot of time, at least a couple of months to understand that, this is
Hmm.
what it is now. And then working on your relationship, I think, becomes a very important aspect. Uh,
Hmm.
so for the couples, they need to understand that the way they loved each other and supported each other before the child will now have to change. So, even sharing the workload, planning some moments to be with each other, maybe after the child sleeps. Uh, so the couple really has to work on their relationship to,
Hmm.
make it going and keep it strong.
Hmm.
Because those initial few months after the child comes is actually a time of transition when
Hmm.
everybody is adjusting to the new reality.
Hmm.
There could be other changes which are happening. So yes, it does affect the emotional as well as mental health state of both the partners.
Definitely. And like you said, The changes in priorities for the
Absolutely.
parents, for both partners respectively, and the stressor now they have another, entire being to look after can bring so much stress and anxiety for them.
Yes.
And just like you said, the support, the changes that comes, just being prepared for it, having a support that can
Mm.
kind of make it easier for them, the transition is
Yes.
a great thing, definitely. So, how did you cope with all of this while you were going through your pregnancy?
Um, a self recovery journey through support of family, through support of friends.
Hmm.
One thing that worked really well for me was peer support. Basically,
Hmm.
I had a childhood friend, and someone with whom I could share, everything in a very non-judgmental manner. And I'm blessed to
Hmm.
have that support. Many mothers don't even have that support.
Hmm.
So peer support is something that I think worked very well in my case. I could call her at any time when I was
Hmm.
feeling very stressed, very anxious, or very, low. And she had gone through the same journey very recently. I mean, just a year before me. So she could understand where I was coming
Hmm.
from, what I was feeling, and just having that space, safe space to talk, and just having an empathetic ear to
Yeah.
listen was what worked really well for me. Unfortunately, I did not take any kind of professional support. Fortunately, I didn't need it. Uh,
Hmm.
but then, support from families, peer support, talking to other moms, uh, understanding that what I'm going through, of course, it happened in the later months where, I could have some control over what was going on.
Hmm.
Initially, it was very difficult to, even do anything. So just understanding, that what I'm going through is normal, and then there is a term for
Hmm.
it, and then I have control over my thoughts,
Hmm.
is what helped.
Yeah.
So that's why, I mean, even at Happiness, uh, besides the programs, beside the professional support that we provide, we understand that, reaching out for professional support as the first step may not be, something that mothers would be comfortable with. So we
Hmm.
have support groups for mothers.
Hmm.
We have peer support options where they
Hmm.
can first, try and choose these options, talk to
Hmm.
other moms, have one-on-one conversations in a very non-judgmental manner with
Yeah.
another mom who has gone through similar experiences. And after that, if they feel that there is still, uh, they, in most cases, after that, they are convinced that, okay, now I need professional support. So for them to understand that becomes an easier process. That's why
Hmm.
we have all these options even at Happiness.
Definitely. And like you said, these support groups really help mothers to understand and also help them to transition into, their own individual therapies.
Yes.
Because, like we discussed and I've seen in my practice, the fact that, okay, do I need to take therapy? How would that be coming into therapy, right? And the fact that I have so many things to look after, there
Mm-hmm.
also the support of family and couples coming in, that for the mother to be away for an hour, to even come in for sessions, come in for support, it sometimes feels a lot. So just having that flexibility with them, that kind of understanding really helps them to then transition, be comfortable with taking services for their mental health.
Yes. Absolutely.
For them, yes, and for us as practitioners, as these organizations, to also help them see that, hey, taking support for your own well-being is eventually going to affect your child as well, and your own maternal health as a woman, as a mother, is important and is here to be looked after, is a huge thing. So I think another intention of mine with maternal mental health is to have enough of these resources and talks for the mothers to slowly also be accustomed to or be familiar with hearing about it.
Yeah.
Be familiar with, okay, so that means that what I'm going through, I can avail services for that. I
Yeah.
can avail services to be more comfortable with myself. For the for everyone here listening to us, definitely. And just as a parting thought, what are some of the services you wish was more prominent, or services that you feel need more, kind of need to be more in the forefront, at least in the maternal mental health?
Yeah. I wouldn't actually call them services. I usually uh, call them as support options for mothers.
Mhm,
So, from my own experience, I feel, like I mentioned, support groups, just having
mm,
that, uh, place where you
mm,
see that others are also going through this, and
mm,
not being in isolation, feeling that.
yeah,
So, support groups, having new mom communities,
mm,
having peer support, or
yeah,
one-on-one uh, uh, one-on-one interactions with moms, and then professional support, be it psychiatrist, be it therapist, all of these things, um, I think would have been very useful if I could have accessed them during my time. Of
mm,
course, there were professional psychiatrists, psychotherapists available out there. But like I said, that to be the first step is actually difficult for,
mm,
you know you go through a number of things, and you may recover in between, or you may need more professional support. And one more thing that I would like to add is prevention. Had there been
mm,
some sort of screening, some sort of education on what are the changes that you should expect
mm,
post childbirth, I think that's must for every expecting parent, and that's what
yeah.
we are trying to do with Happiness.
Definitely. I mean, I agree with all of that, and definitely that is something that I intend to bring in my practice as well, where with the professional support, there's enough for the mothers to have that recognition to be seen about their health, the empowerment to that, and the fact that a service that they can avail while being with their, infant, with their toddler, because online support in that way makes it much more accessible to mothers to be taking it at,
Yeah,
because it often becomes very difficult, even physically, to go out a lot of times.
yeah,
So having these services, having a safe enough space where there's no judgment on your for your concern, or where they understand where your concerns are coming from and how is it coming up for you and for your own self, because while there can be a lot of common experiences among mothers, for every mother their pregnancy journey, their perinatal journey is so unique.
yeah.
To be able to understand that and to have someone, walk with you through that is definitely something that I intend to provide and bring up a lot.
We've covered it all, but it's great that more and more
Yeah.
people are now talking about maternal mental health. We need
Mm.
so much more awareness and so much more discussion about it,
Yeah.
because, like you also mentioned, the more you talk or the more you hear, the more you accept it, and then
Yeah.
the more you normalize it. So we need to
Mm.
normalize these conversations for people to become aware, and people to come out and ask for support, because support is definitely available.
Definitely. And while there's so much more I want to discuss with you and elaborate on, but we'll keep this video for here. That's the scope of this. So thank you so much, Paridhi, for joining in and,
Thank you.
kind of coming up with this conversation. Thank you so much. And to my audience also, please hit a like if you like this, share it with a mother or someone who's going to go through this. Comment your experiences and definitely stay in touch with us for more content on healthcare for the population.